Same stage, same cancer, but completely different DNA. Today's precision cancer question is, should staging remain our anchor or should DNA signatures take the driver's seat? Welcome to Dr. Sudha S. Murthy's Precision Cancer Question, where we challenge the status quo in cancer care, one question at a time. Imagine two women, both diagnosed with stage 2 breast cancer. The tumors are of the same size in the same organ at the same stage. On paper and even in conventional parlance, they look identical. But let's look closer. When we dive into the genetic blueprint of the cancer, the similarities fall apart. One woman's tumor carries an alteration in the HER2 gene that makes her eligible for trastuzumab, a targeted therapy that can dramatically improve her outcomes. The other woman's tumor carries a BRCA1 mutation, which means her cancer behaves more aggressively. For her, PARP inhibitors might be the best line of attack. Under the microscope, these two cancers look similar, but at the molecular level, they are two completely different diseases. And this isn't unique to breast cancer. In lung cancer, some tumors carry EGFR mutations, others carry ALK or ROS. Each mutation unlocks a different drug. In colon cancer, a simple RAS mutation can decide whether a therapy works or fails completely. So, yes, two patients with the same stage, the same cancer type, even similar symptoms can have tumors with completely different molecular portraits. It's like two houses built with the same architectural plan. From the outside, they look identical, but inside one is wired with steel, the other with wood. Repairing them needs different tools. This is the shift in modern oncology, from organ based treatment to biology based care. We are no longer just treating a stage or a tumor site. We are treating a patient's unique molecular story. And that's what makes precision cancer medicine possible. The right drug, the right person, and the right time. Because no two cancers are the same, just as no two people are the same. So here's my question for you. What should steer cancer care, stage or molecular signature? Till the next time, reflect and react. Thank you and bye bye.